To Danny Mortimer, who's the Chief Executive of NHS Confederation. I know that you were listening to that and really moved by what those patients were saying.
Yeah, and Louise, good morning. It's really important that you've given Ali and the others some voice this morning. There are still people out there who are very sceptical about the virus, very sceptical about its impact. And as we heard, COVID is real. COVID does real damage and real harm to people. And it demands, if people need to be hospitalised, it demands really, really high levels of care from my colleagues in the NHS. And, you know, to hear Ali in hospital now for 2 weeks, clearly really seriously ill, missing her family, missing her children, I can't imagine any of your viewers rather, wouldn't be moved by that.
Absolutely. So let's just talk about the situation currently where we are in hospitals this week. How would you assess it?
I think, you know, the truth is, Louise, for this last couple of weeks, I think colleagues have felt very much on the brink. We are in a position now where right across the country, additional capacity is being constantly opened. We're finding areas that would be normally used, for example, to carry out day surgery, normal surgical procedures, and turning those into the kind of beds that you saw members of the public being treated in just a few moments ago. And we're having to take our staff and spread them more thinly. We're having our colleagues who are working in the community and in ambulance services and in GP practices also responding to increased demands for their support. Our colleagues in the ambulance service are experiencing and have experienced now for a couple of weeks really significant delays in the kind of treatment they can offer and their ability to get patients into hospital because of COVID. So yes, our colleagues are working right on the edge of what feels safe or sustainable to them, and that's been the case now for a number of weeks.
Can I ask you about, for example, you know, we know that restrictions were in some ways eased over Christmas. Have we seen the effects of that yet, or is that still going to become a bit obvious over the next few days?
I think what we're seeing right now is the fact that actually the steps that were taken in the autumn and before Christmas weren't effective. I think, as someone just said a little bit earlier on your programme, our following of the rules in November time was much, much weaker than it was in March. And Christmas may well only have exacerbated that position. But no, we're dealing with the consequences now of many, many weeks of the spread of the virus, and as the infections increased and the impact on the health service and obviously the impact on people's health grows very, very rapidly indeed.
So I suppose the converse of that is we've now seen tighter restrictions. And when would you hope, if they're going to work, they would start working?
Our experience back in the spring was that within a couple of weeks we felt the benefit of the lockdown. As I said in November, that didn't play out in exactly the same way, and this is, you know, we're a week now into the sort of national lockdown. So based on earlier experience, the advice that's been given the NHS is that it will be another week or two until we feel the full benefit of that. And there are obviously other things that we need the government to look at. We need them to look at a test, trace and isolate system that works effectively and sustainably, and we're not there yet with that. We need the government to make sure that the rules that are put in place, as well as all of us committing to follow them, that the government makes it as easy as possible for people to follow them. So, you know, is the economic support good enough for people that are having to isolate, particularly people in the lowest paid jobs and the most deprived households? Is there a sufficient support for business to enable businesses to scale back and to allow some of their people to be furloughed or to stay at home? All of those things are really important questions as we move forward.
And we know that the vaccine is being rolled out, that people are getting it every day. When also will that start making a difference on the impact in hospitals, for example?
I think that, you know, the reality is that the impact across the health service is being felt now and will be felt for many weeks to come. We will feel, you know, in the population, the fact that we are vaccinating the most vulnerable, those most likely to die, we'll feel the benefit of that in the next couple of months as the vaccine takes effect. But clearly, the issue with the virus is of course about the lives that it takes, but it's also about the lives that it ruins. We know that the virus can create pressures and issues for people for the longer term, maybe even for the rest of their lives, the kind of long COVID that we've talked about a lot over this last 6 months. So actually, we won't feel the full benefit of the vaccination programme for many, many months. And that's why, to repeat the message that Professor Whitty gave you yesterday, and to repeat the message that I'm sure a large number of people have given you this morning, it is so vital that all of us follow the rules. That particularly we follow the rules in terms of our internal spaces, and it's also really important that the government keep this position under constant review and are ready to act decisively and with clarity. Appreciate entirely the guidance that's offered the public can always be clearer and always bears repeating, but those things are really important in the here and now and in the coming weeks.
Danny Mortimer, Chief Executive of NHS Confederation, thank you for your time on Breakfast this morning.
Thank you.